Hi, everybody. I'm David Bayada, CEO here at Bayada Home Healthcare. Today is Wednesday, March 25th, and this is the second episode of our CEO Daily COVID-19 update. I'm here with Nora Triola, our Chief Clinical Officer here at Bayada, and today we're going to talk a little bit about a topic that I'm not sure I ever thought I'd be talking about on a webcast like this, but these little things have become a really hot topic. And these masks are critical to ensuring the safety of our employees and the safety of our clients. And they've really become a hot button issue here at Bayada and across the country because they're in such short supply. And I want to talk a little bit about what Bayada is doing, what the industry is doing, and also a little bit about, with Nora's help, a little bit about what you can do and to help ensure that we have the right supplies, the right equipment for the right clients at the right time. And so first, let's just start. I'll orient you to the props, right? We've got a N95 mask as well as a surgical mask. What we don't have here are some of the non-PPE, what we're calling comfort masks. So these are cloth masks or the type of mask that you can buy off the shelf, for example, at Walmart or Target, that often are asked for as a preference by clients and sometimes by you all employees. Those are situations where they're not warranted by clinical guidelines, but they are potentially asked for as a preference by clients and employees, which we absolutely honor and respect. And we're going to talk a little bit about that with Nora. But first, I want to talk about what we're doing here at Bayada to deal with this incredibly complicated issue around supplies and masks in particular. As I mentioned before on yesterday's episode 1, I've been working 24/7 with an incredible team here at Bayada and also with our peer organizations around the country to figure out how we can source and distribute supplies to ensure you have everything you need to be safe and keep your clients safe. We're talking every day, 10 times a day. I'm on the phone with distribution centers and factories, and it's been really an intense collaborative effort, and I'm hopeful that we're making progress every single hour of every single day. Earlier, I was down in our makeshift distribution center here at the Global Support Center in Pennsauken, New Jersey. I'd like you to take a look. We're here at our Global Support Center in Pennsauken, New Jersey, which is usually occupied by 500 people that are working on ensuring accurate paychecks, sending out bills and claims to our insurance reimbursement sources. But right now, instead of our training center, we've got a distribution center. Because we were having a hard time getting all the supplies you need from all the different vendors all over the country, we decided to bring them here and then distribute them ourselves out to the local offices so they can get to you out in the home, out in the community. And so you can see, we took a training and conference center and turned it into a big storage facility where we've got gloves, we've got masks coming in from China, and all kinds of other equipment that we're now taking inventory, getting it all set up, putting it in cars, and delivering it out to the service offices so they can get out into the home of our clients to keep you all safe and keep them safe. So that gives you a little bit of a window into some of the things we're doing to try and get creative, flexible, and determined here at Bayada. And as the Bayada way tells us, creativity, flexibility, and determination are a hallmark of making sure we put our clients first. And it's been an amazing effort to try and get you what you need to be safe out in the community. So I want to check in with Nora now, our Chief Clinical Officer, a registered nurse with incredible experience across her career in the hospital as well as in home care. I want to talk a little bit about these masks. Nora, can you tell us a little bit about the N95 mask? It's a term that you see in the news all the time, and I know a lot of clinicians are asking, I need an N95 in order to take care of my clients. Can you talk to us about what an N95 mask is, why it's different, and when it's needed?
Sure, happy to talk about an N95. An N95 is something many of our clinicians have used before. We've used them during care for clients with airborne precautions. So when we have clients with TB, we use those masks. When we have other kinds of infections, we use those masks. And now we're going to use them for the COVID-19 positive clients. So that's the only real time that you're going to need an N95 is when we have a result from a client that tests positive for COVID-19.
That's great. Thanks for sharing, Nora. And I think one important thing about this is that there are instances where employees are asking for N95s to take care of clients that are not positive. And so what that does, because they're in such short supply, is it takes away our inventory for the inevitability when we have clients that need them because they are positive. This is a really important thing. And so it's critical that everybody works with their clinical manager, with their director, to figure out, do I need this thing? Is this the right type of equipment for the client home that I'm going to be entering? Thanks, Nora. Now tell me about the surgical mask. When's the surgical mask appropriate, and how should I be thinking about it?
Sure. The surgical mask is, again, another tool that we use in our personal protective equipment that all the clinicians have become very familiar with. We use that for standard precautions as well as droplet precautions. We use that mask when there's a possibility that there could be a splash, or there could be bacteria or viruses that could move in a droplet kind of way onto us. And so we protect ourselves with the mask.
That's great. Perfect. And then the type of masks that I mentioned I don't have here are some of those that you get off the shelf at Walmart, or in some cases people are manufacturing ones made out of cloth. And I think one of the things that we're doing is constantly changing our approach to when these types of, when those specific masks are appropriate. And we're getting lots of requests when clients request that those types of what we call non-PPE comfort masks are needed, which we're totally comfortable with. But there are some things that our clinicians need to understand about making sure we also keep them clean. And so can you tell us a little bit about the non-PPE comfort masks, even the ones that people are making out of cloth, how to ensure that they're used properly?
Happy to. We haven't ever had them before. We haven't had the need to use them. So many of our clinicians are familiar with the first two that we've talked about, the N95 and the surgical mask. This is now something that may look a little like a surgical mask, but it's really able to be bought in most department stores and or homemade. What we want you to do is, if you're using a disposal one, to put an X on it so that there's no confusion that you are not using personal protective equipment when you don't need to be, or vice versa. The other thing that you need to think about is, those are kind of the ones that we would prefer you use, because if you feel like you or the client you're serving would be more comfortable with the mask, we want you to have that available. The nice thing about the disposable ones is just that they're disposable. We know that there's been some challenges ordering them. We're ordering them for the organization, and please seek your director or your division director if you need some of those supplies. But we're also okaying the use of the cloth ones. There's several things you need to think about with the cloth ones, and that's really around the cleanliness and the maintenance of those. So if they get soiled, they need to be washed, just like any of your uniforms and things you bring into the home as you go from client to client. Any soiling you should not use them again. And make sure though that when you handle them, that you are washing your hands in between your putting them on and then taking them off.
That's great. Thanks, Nora. So just as we close, I want to reiterate a couple of things that you out there in the field can do to ensure that we rise to the occasion and answer the call of duty to take care of our clients at home. First, be safe, right? We've got an amazing amount of work going on to ensure you have the supplies you need for the clients that need it, but also be mindful, ask questions of your clinical manager and your director, your client service manager, to clarify which types of supplies are appropriate for each client, because it's changing. It's moving a mile a minute. The number of cases is escalating. The availability of supplies is fluctuating. And so we're constantly trying to adjust our approach and our guidance, and we're also adjusting our inventory based on our success in building the distribution center out and getting supplies from out on the marketplace. So ask questions, ask them every day if you need to seek clarification, make sure you have all the information you need to be safe out in the community and keep your clients safe. Thanks again. I want to express gratitude. I want to recognize Nora and her team who are doing an amazing job making sure that we have all the protocol and all the supplies and all the policies in place to help keep everybody safe. And I want to thank everybody out in the field because you're doing amazing work. You're answering the call of duty in a time of anxiety and uncertainty, and our clients are depending on you to do that. So thank you.